That faint pink you might see in the sink after brushing your teeth. Many of us dismiss it. We think, maybe I brushed too hard, or my gums are just a little sensitive today. We rinse the sink and move on with our day, thinking nothing of it. But what if that small, seemingly insignificant trace of color was not just a minor gum issue, but a direct warning signal from the very core of your circulatory system, your heart? For decades, we've been conditioned to see oral health as a separate entity, a world of its own confined to clean teeth, fresh breath, and avoiding cavities. It's been treated as a matter of cosmetic appearance and local comfort, completely detached from the intricate workings of the rest of our body. But a wave of compelling scientific evidence is shattering that outdated belief, revealing a profound and startling connection that we can no longer afford to ignore. The truth is, the health of your mouth is a direct reflection of the health of your body, and the bacteria that thrive in inflamed, bleeding gums do not politely stay where they are. They are opportunistic invaders. When your gums are compromised, they become a porous gateway, an open door into your bloodstream. Once inside, these microorganisms embark on a journey throughout your body, triggering a dangerous, silent state of chronic, low-grade inflammation. This isn't the kind of acute inflammation you feel from a cut or a burn. This is a subtle, persistent fire smoldering within your blood vessels, day after day, year after year. This silent inflammatory cascade is now understood to be a key architect of arterial plaque, the very substance that slowly hardens and narrows the vessels, supplying your heart with life-giving blood and oxygen. What begins as a bit of overlooked gum sensitivity can, over time, become the hidden root of serious, even life-threatening cardiac events. This transforms the simple, often neglected act of flossing from a mere dental chore into a critical daily defense for your heart. It's not just about preventing cavities anymore. It's about preventing a heart attack. I am Dr. Lucas Mason, and in my more than 20 years of caring for patients navigating the complexities of cardiovascular health, I have seen how the smallest, most overlooked symptoms can often hold the biggest clues to our well-being. I've witnessed firsthand how understanding these hidden connections can empower individuals to take control of their health in ways they never thought possible. So how deep does this connection really go? And what can you do, starting tonight, to turn this risk into a powerful form of protection? Before continuing, if you haven't subscribed yet, click the bell icon so you don't miss out on any health tips designed especially for you. If you like the video, give it a thumbs up and leave a comment. If not, give it a thumbs down to help us improve. To truly grasp the significance of this connection, we must first unlearn a fundamental misconception: that the mouth is isolated from the rest of the body. Think of your body as a highly secure and sophisticated fortress. It has walls, gates, and guards designed to keep invaders out. Your skin is the most obvious outer wall, but inside you have another critical barrier, the lining of your mouth and gums, known as the oral mucosa. When this barrier is healthy, it's like a perfectly sealed, impenetrable wall. It keeps the vast ecosystem of bacteria in your mouth, and there are billions of them, both good and bad, safely on the outside, preventing them from entering the sterile environment of your bloodstream. But what happens when this wall is breached? This is precisely what occurs with gum disease, or periodontitis. It starts subtly, often as gingivitis, characterized by that redness, swelling, and bleeding when you brush. This is the first sign that the bad bacteria have begun to win the battle. They produce toxins that irritate the gum tissue, causing inflammation. Inflammation is the body's natural response to injury or infection. It's a call to arms, sending immune cells and blood to the area to fight off the invaders. That's why your gums get puffy and red. However, in the case of gum disease, this isn't a one-time battle. It's a chronic state of war. Every day, these bacteria relentlessly attack the gum tissue. This constant inflammation starts to break down the very fibers that attach your gums to your teeth, creating small pockets. These pockets are the perfect breeding ground for the most dangerous types of anaerobic bacteria, the ones that thrive without oxygen. They multiply deep within these crevices, safe from your toothbrush. And as these pockets deepen, the inflammation worsens, causing the delicate lining of the gums to become ulcerated and permeable. It's no longer a solid wall. It's a compromised, leaky barrier. Now imagine this. With every bite of food you take, every time you brush your teeth, you are physically pushing these colonies of aggressive bacteria directly through the damaged gum lining and into the tiny capillaries that are abundant there. This is a daily repeated invasion. It's not a single event, but a constant seeding of your bloodstream with inflammatory bacteria and the toxins they produce. Have you ever considered that? That a simple meal could be pushing harmful bacteria directly into your circulation? This is the heart of the mouth-body connection. The mouth is not Las Vegas. What happens in the mouth does not stay in the mouth. It travels. And its first destination is your entire cardiovascular system, setting the stage for a silent, destructive process that can take years to manifest. But its origins can be traced right back to that pink in the sink. It's a sobering thought, but also an incredibly empowering one, because the integrity of that barrier is largely within your control. So what exactly happens once these oral bacteria slip past the gatekeepers in your gums and enter the vast network of your bloodstream? This is where the story moves from a local issue in your mouth to a systemic problem affecting your entire body. The primary culprits are specific strains of bacteria with names like Porphyromonas gingivalis and Streptococcus mutans. These aren't just any bacteria, they are masters of survival and manipulation. Once in the bloodstream, they don't just passively float along, they are active participants. Your immune system immediately recognizes them as foreign invaders and mounts a response. White blood cells are dispatched, and inflammatory chemicals called cytokines are released into the bloodstream. This is the body trying to protect itself. But remember, this isn't a single invasion from a cut on your finger. Because the source of the infection, your gums, is chronic, this bacterial seeding happens over and over again, every single day. This creates a state of chronic, low-grade inflammation throughout your entire circulatory system. Imagine a low-level fire constantly smoldering along the delicate inner lining of your arteries, a layer of cells called the endothelium. A healthy endothelium is smooth, flexible, and almost Teflon-like, allowing blood to flow freely. But chronic inflammation is like sandpaper to this smooth lining. It damages the endothelial cells, making them rough and sticky. This is a critical turning point. This damage is an injury, and your body's response to an injury is to patch it up. One of the patches it uses is cholesterol, specifically LDL cholesterol, often called the bad cholesterol. In a healthy artery, LDL cholesterol would just pass on by, but on a damaged, sticky, inflamed arterial wall, it gets trapped. It's like a car getting stuck in a pothole on a poorly maintained road. Once the LDL cholesterol is trapped, it begins to oxidize, which triggers an even stronger inflammatory response. The body sends macrophage immune cells to clean up the mess. These macrophages gobble up the oxidized cholesterol, but they become so engorged that they transform into what are known as foam cells. These foam cells are one of the primary components of arterial plaque. This is the beginning of atherosclerosis. This plaque is a dangerous mixture of cholesterol, cellular waste, calcium, and fibrin. As this inflammatory cascade continues, fueled by the daily influx of oral bacteria, the plaque deposit grows. It's like a slow, silent hardening and clogging of your arteries. The vessel that was once a wide, flexible highway for blood becomes a narrow, stiff, and congested alley. This process, known as stenosis, reduces blood flow to your vital organs, most critically, your heart. When the arteries supplying the heart muscle, the coronary arteries, become too narrow, you can experience symptoms like chest pain or angina. But the real danger lies in the stability of this plaque. The same inflammation that helped create the plaque also makes it unstable and prone to rupture. Inflammatory enzymes can weaken the fibrous cap that covers the plaque deposit. If that cap breaks, the body perceives it as a severe injury and immediately forms a blood clot to seal the rupture. This clot can be the final, catastrophic event. If it's large enough, it can completely block the already narrowed artery, cutting off all blood flow to the part of the heart muscle it supplies. This is a heart attack, and it's terrifying to think that the chain of events leading to this moment could have begun years earlier, silently, with bacteria from inflamed gums setting off a smoldering fire within the arteries. The science is clear. Periodontal disease is recognized as an independent risk factor for cardiovascular disease, just like high blood pressure, high cholesterol, and smoking. This isn't a fringe theory. It's established medical science. The link is direct, measurable, and profoundly important for everyone to understand. I remember a patient I had a few years ago, a man named Robert. He was 58, a successful accountant, and meticulous about his health. He came to see me for regular checkups. He watched his diet, he exercised 3 times a week, and his cholesterol and blood pressure were always within a healthy range. He felt he was doing everything right. During one of his visits, I asked him about his oral health. He waved his hand dismissively. "Oh, it's fine, doc," he said. "My gums bleed a little when I brush, but they always have. I figure it's normal for me." I tried to explain the potential connection to his overall health, the inflammation link, but he saw it as a minor dental issue, completely separate from the real health metrics he was so carefully tracking. He was focused on the big numbers, the cholesterol panels and the blood pressure readings, and couldn't see how something as trivial as bleeding gums could possibly impact his heart. About 6 months later, I received a call. It was Robert, but his voice was different. It was shaken. He had been on a treadmill at his gym when he felt a strange pressure in his chest and a shortness of breath he'd never experienced before. He was smart enough to stop immediately and go to the emergency room. The doctors there ran a series of tests, and while he hadn't had a full-blown heart attack, the results of his angiogram were a shock to everyone, especially Robert. They found significant blockage, around 60%, in one of his major coronary arteries. He was a walking candidate for a major cardiac event. Robert was baffled and scared. "How could this happen?" he asked me during a follow-up appointment. "I did everything right. My cholesterol isn't even that high. What did I miss?" His cardiologist, a brilliant and forward-thinking colleague, had asked him the same question I had. "Tell me about your oral health." This time, Robert didn't dismiss it. The cardiologist explained to him that while his cholesterol numbers weren't in the danger zone, his blood tests showed elevated levels of C-reactive protein, a key marker for inflammation in the body. They couldn't find an obvious source. No other infections, no autoimmune issues. The investigation led them back to his mouth. A thorough examination by a periodontist revealed that Robert had moderate to severe chronic periodontitis. The pockets around his teeth were deep and the infection was advanced. The periodontist told him, "Your gums have been like an open wound, leaking bacteria and inflammatory byproducts into your system for years." It was a devastating revelation for Robert. The puzzle pieces clicked into place. The silent, smoldering fire that had been building up plaque in his arteries was very likely being fueled by the chronic infection he had dismissed as normal. He underwent a procedure to place a stent in his artery, and at the same time, began an aggressive treatment plan for his gum disease. It involved deep cleanings, antibiotics, and a new rigorous daily oral hygiene routine. I saw him a year later. The change was remarkable, not just physically, but in his entire mindset. "Doc," he said, "I used to think flossing was a waste of time, something dentists nagged you about to sell more floss. Now I see it completely differently. Every night when I floss, I feel like I'm cleaning out my arteries. It's become a non-negotiable part of my health routine, as important as taking my blood pressure medication." Robert's story is a powerful reminder. The clues to our health are not always found in the big obvious places. Sometimes the most profound warnings come from the smallest, most easily overlooked signs. His journey taught him and me that true health is an integrated system, where the health of your gums is inextricably linked to the health of your heart. Robert was lucky. He got a warning shot. His experience serves as a crucial lesson for all of us. Don't wait for the warning shot. The time to act is now, when you first see that faint pink in the sink. So we've established the problem. We understand the science, and we've seen through Robert's story just how real the consequences can be. Now comes the most important part, the solution. How do we build an impenetrable defense system, starting in our mouths to protect our hearts? This is where you take back control. The good news is that the foundational strategies are simple, accessible, and incredibly effective. Let's start by looking beyond the toothbrush. Brushing is essential, of course. It's fantastic for cleaning the smooth, visible surfaces of your teeth, the front, the back, and the chewing surfaces. It removes food particles and surface plaque. But here's the critical limitation. A toothbrush cannot effectively clean between your teeth, or more importantly, get down into the small space between your tooth and your gum, known as the sulcus. This sulcus is where the danger begins. In a healthy mouth, it's only about 1 to 3 millimeters deep. But when gingivitis and periodontitis set in, this space deepens into an infected pocket. The bristles of your toothbrush simply can't reach the bottom of these pockets where the most harmful bacteria are colonizing. So while you might be brushing diligently twice a day and your teeth might look clean, you could be completely missing the area where the silent invasion is being launched. This is why you need a more specialized toolkit. Think of it as assembling a team of defenders, each with a specific role. First and most importantly is dental floss. This is the unsung hero of oral and cardiovascular health. We need to completely reframe how we think about floss. It is not just for dislodging a piece of popcorn stuck between your teeth. It is a medical instrument designed to disrupt and remove the sticky, invisible film of bacterial plaque from the two surfaces of the tooth that your brush can't reach. Proper technique is everything. Simply snapping the floss down and up is not enough. The most effective method is the C-shape technique. You take a piece of floss, wrap it around the tooth in a C shape, and gently slide it down below the gum line until you feel slight resistance. Then you scrape the side of the tooth, moving up and away from the gum. You do this for both sides of every single tooth. Yes, it takes a couple of minutes, but what are 2 minutes compared to the health of your heart? Next, consider adding other tools to your arsenal. For people with larger gaps between their teeth, braces, or significant gum recession, interdental brushes can be even more effective than floss. These are tiny cone-shaped brushes that can scrub the sides of the teeth clean. Then there's the water flosser. This device shoots a pulsating stream of water to flush out food debris and bacteria from between teeth and below the gum line. While most studies show it's not a complete replacement for manual flossing when it comes to removing sticky plaque, it's an incredibly powerful adjunct. Using a water flosser first can flush out the larger debris, making your subsequent flossing more effective. It's also excellent for massaging the gums and improving circulation. Your choice of mouthwash also matters. Look for an antiseptic or antibacterial mouthwash. Rinsing with one of these can help reduce the overall bacterial load in your mouth, reaching areas that even floss can't. Think of it as a final rinse for the entire oral environment. Finally, and this is non-negotiable, you must have a professional on your team, your dentist and dental hygienist. Regular professional cleanings are not just a cosmetic procedure to polish your teeth. During a cleaning, the hygienist uses specialized tools to remove tartar, or calculus, which is hardened plaque that you cannot remove at home with a brush or floss. Tartar is like a coral reef for bacteria, providing them with a protected surface to multiply on. Removing it is essential for restoring gum health. Your dentist also measures the depth of your gum pockets, which is a critical indicator of periodontal disease. This is how you track whether your home care is working and catch problems before they become severe. A visit to the dentist should be viewed as an essential part of your cardiovascular health screening. You get your blood pressure checked, you get your cholesterol checked, and you should get your gums checked. This is your complete defensive toolkit. It's a multi-pronged strategy to ensure you are defending that critical barrier every single day, keeping the invaders out of your bloodstream and away from your heart. Let's focus more deeply on the single most transformative habit you can adopt for this cause: flossing. I know for many people, the word itself brings up feelings of guilt or annoyance. It's the one thing we all know we should do, and the one thing many of us lie to our dentists about. Why? Because we see it as a chore. It feels tedious, an unnecessary extra step after we've already done the important part of brushing. But as we've discussed, this perception is fundamentally flawed. Flossing isn't an optional extra, it is the frontline defense. If brushing is about cleaning the house, flossing is about checking the locks on the doors and windows to make sure no intruders can get in. I want you to perform a small mental exercise with me. The next time you are standing in front of your bathroom mirror, ready to go to bed, I want you to consciously change the narrative in your head. Instead of thinking, ugh, I have to floss, I want you to think, I am now taking 2 minutes to actively lower the inflammation in my body. I am protecting my arteries from plaque buildup. I am doing something directly for the health of my heart. Can you feel the shift? The action is the same, but the intention behind it is transformed. It's no longer a mundane chore. It's a profound act of self-care and preservation. It's a ritual of health. When you use that piece of floss and see the plaque it removes, don't be disgusted, be satisfied. That is physical proof of the bacteria you are preventing from entering your bloodstream. Every single particle you remove is a victory for your cardiovascular system. Let's talk about the excuses. It makes my gums bleed. This is the most common reason people give for not flossing, but this is a complete misunderstanding of what's happening. Your gums are not bleeding because the floss is injuring them. Your gums are bleeding because they are already sick and inflamed from the bacteria that the floss is there to remove. It's a sign of active infection. When you see that blood, it should be a wake-up call, not a reason to stop. It's your body telling you, thank you for finally cleaning this infected area. If you start flossing correctly and consistently, the bleeding will typically stop within 1 to 2 weeks. That's the sign that the inflammation is receding and the gum tissue is healing and becoming resilient again. Another excuse, I don't have time. We all live busy lives, but can we honestly say we cannot find 120 seconds in a 24-hour day for a habit that could potentially prevent a heart attack? We scroll on our phones for hours, we watch another episode of a show. The time is there. It's a matter of priority. And what could be a higher priority than the organ that beats over 0 times a day to keep you alive? Make it a non-negotiable ritual. Put the floss right next to your toothbrush so you can't ignore it. Do it at the same time every single night until it becomes as automatic as brushing itself. The simple, humble act of guiding a piece of string between your teeth is one of the most powerful and scientifically backed ways to reduce your risk of heart disease that is entirely within your own hands. It costs pennies a day and takes minutes to perform. There are very few things in medicine that offer such a high return on investment for your health. So let that be the message that sticks with you. Flossing is not about your teeth, it's about your life. As we draw to a close, I want to bring all these ideas together into one clear, actionable message. We've journeyed from a simple observation, a hint of pink in the sink, to the complex world of microbiology and cardiovascular inflammation. We've seen how the bacteria in our mouths can embark on a destructive journey through our arteries, and we've learned through stories like Robert's that ignoring this connection has real, serious consequences. But knowledge is only powerful when it is put into action. The most important takeaway from our time together today is this: your body is one interconnected, magnificent system. There is no separation between your oral health and your overall health. A healthy mouth is not a luxury or a cosmetic concern. It is a fundamental pillar of a healthy heart and a long, vibrant life. We've talked about the science and the tools, but it all comes down to a daily commitment to yourself. It's about transforming your mindset. The 5 minutes you spend each morning and evening caring for your oral health are not lost time. They are a direct investment in your future. They are a powerful statement that you value your well-being. So here is my final piece of advice, a challenge for you to take on starting tonight. I want you to create a new ritual. Don't just brush your teeth. Instead, perform a deliberate cardiovascular protection routine. Start with your water flosser if you have one, flushing away the debris. Then, mindfully and carefully, take your dental floss and clean between every single tooth, visualizing that you are removing inflammatory agents from your body. Finish with your toothbrush, cleaning all the surfaces, and finally rinse with an antiseptic mouthwash to complete the process. As you do this, don't rush. Be present. Feel the satisfaction of knowing that with this simple 5-minute act, you have taken a concrete step to reduce inflammation, protect your arteries, and honor the heart that works so tirelessly for you. This small change in routine and perspective can have a ripple effect on your entire life. What begins as a commitment to flossing can grow into a renewed commitment to better nutrition, to more regular exercise, to managing stress. It's a cornerstone habit that proves you have the power to influence your own health destiny. The power to prevent disease often lies not in complex medical procedures or miracle drugs, but in the small, consistent, daily choices we make. You hold that power in your hands right now. Don't underestimate the profound impact of these simple actions. The journey to a healthier heart can literally begin with a single strand of dental floss. Thank you for joining me today. What is one small change you will commit to making for your oral and heart health after watching this? Share your commitment in the comments below. Your story might be the inspiration someone else needs to start their own journey, and if you found this information valuable, please share it with the people you love. Together, we can change the conversation around health, one healthy smile and one healthy heart at a time. Be well and take care.